So one of the questions we received today was if you have more than one child with ARFID, do you do these exposures separately or at the family meal table? So would you cater a different exposure for each child?
Yes. Yeah, you want to have all of your focus on one child at a time. If you're trying to do this for two kids at once, you're going to burn out really quickly. And you also want to add some of that social aspect into eating again. So a lot of times we see individuals with ARFID are trying to avoid the social aspect of eating. And it's so beneficial to be eating with your family or eating with someone else. And you have that social praise. And if that's taken away by 50% to one child, 50% to another, then it's not as meaningful as it could be. But for sure, if you're doing two different child's tasting sessions, do them separately. Yeah.
I personally think, too, you should start with the child that you think you'd have the most success with, and that'll create momentum and confidence, build some confidence in you as a parent to then apply those strategies to the child that's showing more resistance to trying new foods.
And a bit of a related question. Would you recommend involving siblings on tasting sessions for peer modeling?
Yeah. I am a sibling of an individual with a disability, and her feeding program was quite challenging, and they brought me in and did some modeling of eating, and it was very beneficial for our relationship and also for her eating. I think a lot of kids are often very competitive with their siblings and therefore want to impress one another, outdo one another. And if your kids are like that, then that might be beneficial. But if the child that you're teaching couldn't really care less about if their sibling is eating it or not, then it might not be beneficial. But it's never something not to try. Give it a try. Yeah.
Just hopping back to ARFID, who would formally diagnose that condition if someone was interested in pursuing that?
ARFID diagnosis we've had doctors that have given ARFID diagnosis, psychologists. We can assess for it. We can't diagnose and give a diagnosis, but we can assess and see if it might be present.
But it's usually your pediatrician.
Pediatrician or a doctor, yeah.
So some related comments about thinking that this process is going to be a lot harder the older the child gets. Yeah. So if you have any comments on that or any suggestions on, if you have an older child, and the word used here is they think it's hogwash.
Oh, the child thinks it's hogwash? Oh, yeah, no, it's really tricky when the child's not motivated. Absolutely. There has to be show some initiative on the child's part, especially as they're older, for change.
We find the ages of 8 to 12 seem to be the hardest.
Yeah.
Because they are very unwilling to change their behaviors. They don't see their eating patterns as being negative. They haven't felt that social impact yet. But once kids are around the age of 13 or 14, they start to realize that what they're doing in their eating meal routine is way different than their friends or the kids at school. So they're a little bit more socially or internally motivated to change. But that's not true for
or there's health concerns. It becomes more apparent as you get older, the effect it's having on your health. But if you do have a child that's older, that's unmotivated to try new foods, we suggest just keeping your expectations quite small and just aim for some flexibility or some change in eating. So start with just really easy foods and just keep adding them slowly and slow and steady. Yeah.
All right. So just to reiterate, because I'm not sure, I think it might have been spoken to before, but would the tasting sessions ideally be immediately preceding a mealtime? And there was also a question about finding the balance between, hungry and hangry. Yeah. So if you have any tips on how to identify that.
Yeah, you definitely want to do the tasting sessions when your child's hungry. So before their mealtime is ideal, or when you would have a scheduled snack, doing it instead of having a big, heavy snack. Try a tasting session of something so that they're more likely to be hungry at the next meal that you do.
And then, and we find that too, that kids sometimes are just too hungry at the beginning of session and very unwilling to participate. So we start with 5 bites of an easy food just to help curb those hunger pains. And then we introduce the new food. So you don't want your kids to be hangry. And if they are, then once they're sitting at the table, give them a small portion of something easy. Yeah.
Okay, and speaking of sitting at the table, what if you have a child who seems particularly grossed out by other people eating? So, any tips to get them to sit at the table?
Exposure. Exposure.
Yeah.
I mean, pre-COVID, we haven't done a lot of these cases recently, but yeah, we would typically bring food with us, or we'd be eating the same food with the child at the table, and starting out with safer foods, and then eventually graduating to harder foods. So they get used to watching other people eat. Sometimes it's just the act of watching someone else eat. Sometimes it's the unfamiliarity of the smell of the food that can throw some kids off. Against those sensory properties can be really hard for kids. But yeah, just exposing them in small increments, slowly getting the food closer to them. Yeah.
We do find that, though, when we introduce new foods, a nice collateral effect is that they're then able to cope and sit at a meal with their family. We had one little guy years ago who eating with his family members was so difficult for him that his grandfather had built him a castle. It was shaped like a castle, but essentially a cardboard barrier that he put around him so he could sit physically at the table with his family, but he didn't have to see what they were eating, because just the sight of their food would make him want to vomit. And sure enough, once we did teach him some mindfulness strategies on how to cope when he was having some of these thoughts or feelings, but also through the exposure of trying new foods, he learned to manage the smell, the sight, and the texture, and then eventually didn't need that barrier at family meals.
All right, so the last two questions are both around reinforcements and rewards. So one parent shared that their child will refuse their favorite reinforcement when it comes to trying not preferred food. So I'm wondering if there's any suggestions you have for maybe identifying what the best reinforcement would be for a child.
Oh gosh, you have to be so creative sometimes. I don't know if any of you have watched Pat and Katie's toileting, but they always go on and on about being really creative about your reinforcement that you're using. You have to really think outside the box. Yesterday, working with a boy with PDA, and I had him up on my shoulders, and shoulder rides were all that were cool for about 30 minutes until they stopped working. So take a bite of food, then we go up on Chantel's shoulders and we run around the room, and then we come back down, and then we take another bite of food to go back up on the shoulders, run around the room. And then after 30 minutes, like I said, totally bored of that, so we had to find something different. But yeah, thinking outside the box in regards to reinforcement. Sometimes just escaping from the table can be beneficial. Just taking that break. So again, with this particular boy that I'm working with, he would do 10 responses to a food really fast. Even if there were bites, like full-size bites of food, he'd do the 10 bites really fast just so he could leave the table for 3 minutes. And that in and of itself was reinforcing. He could access his preferred toys. There was always a TV on somewhere in the house, so he'd run to that. And then we transition back and do the next 10. So yeah, it really, really depends. Creativity levels have to be pretty high to figure out some things that are going to motivate.
I think you actually just answered my next question, but there was quite a bit of discussion around pathological demand avoidance in the chat earlier today. So just comments that, when they're faced with a demand, they get a lot of anxiety and tend to respond negatively regardless of the reinforcement. So I know you just mentioned, escape as a reinforcement. So if you had any additional comments on that.
Just start with one bite
Yeah.
and then allow
One
the child to
small
escape.
demand.
Yeah.
One smell, go. Then 2 smells, go. 3 smells, go.
Or a break from the table,
Yeah.
and then come back and do another one, and then a break from the table. The
Yeah.
break is the reinforcer.
And the breaks are always longer than sitting at the table.
Yeah.
So that is actually motivating to to get away from.
All right, and just one final question here. So will eating better help in a child's ability to tolerate things overall? Better emotional regulation, etc.
Yeah.
Absolutely. We feel like it's a pivotal behavior and has.
It
Yeah.
has so many small skills that you don't really realize are happening. You're sitting at a table, you're talking with someone, you're being social. Language skills start to increase. When we're sitting and doing sessions, we are often teaching things we don't realize we're teaching, like how to ask questions appropriately, how to just request for food items, how to chew and swallow appropriately, how to chew with our mouth closed, how to use a napkin, and then all of those skills translate to other areas of life too.
How to cope in the moment when it's difficult.
Yeah.
How to use appropriate language to get out of a situation that's challenging. So ask for a break rather than running away.
Negotiation skills, yes.
Yeah.
Teaching the future CEOs and lawyers of the world. No.